Hi, my name is Rob Gordon. I'm currently in my late 60s, and about 3 years ago, I was correctly diagnosed as having ADHD by a psychiatrist at a government-funded community clinic here in San Diego, and I was also successfully treated, and my life got better in every way. I won't go into that story much here. I'll be telling it in other videos. Um, but what happened is when my psychiatrist left that organization under somewhat mysterious circumstances, a lot of people were left in the lurch and no longer got mental health treatment. I was one of them. I was forced into a medically unsupervised withdrawal from the medications they had prescribed. And later, my successful mental health treatment program was criminalized. The psychiatrist who did this, two of them actually, who I have never met in person, these were both brief online meetings of less than 10 minutes each. One of them was non-consensual. Um, Absolutely polluted my psychiatric records. I mean, with volumes of text. My real psychiatrist, who I saw in person for about a year and a half, wrote honest reports. Yeah, I met him in person, honest professional reports. But this particular person just polluted my psychiatric records, and it has haunted me ever since. In an attempt to try to get my successful treatment back, uh, I most recently have gone to UCSD Health. I had to get a general practitioner for that. She was helpful. And I was eventually referred to this man. His name is Dr. Gregory Bishop. Um, and after a time, it took about a month, even though my general practitioner said it was urgent. I believe that's STET in their lingo. I was eventually able to get an appointment with him, and he was thoroughly briefed on the situation. At least I think he was, by the administrative staff at UC San Diego Health, and by myself in the session itself. So what I'd like to do in this meeting is give people a chance to see my psychiatric records. I'm going to critique it at the same time. Um, and this is really being done for three reasons. One, for a potential complaint I'm going to make against Dr. Bishop to the Medical Board of California to provide feedback to the psychiatric department at UC San Diego Health. And finally, just for general interest, to people in the public who have never seen a psychiatric report, people don't typically share them, uh, and maybe just to get your take on what's going on. So let's get started. I haven't been able to learn much about Dr. Bishop. He has more than 20 years experience, all at the same organization, all at UC San Diego Health. I was able to find this on US News, which provides summaries of psychiatrists. His focus, they say, is on gay, lesbian, and transgender issues. His specialties are psychopharmacology and addiction. If I can give one little hint, unless you do have an addiction problem, don't ever go to a psychiatrist who has a specialty in addiction. They will find a way to call you a drug addict. To a little boy with a hammer, everything looks like a nail. But there's no huge red flags here. He's not a match for me. I have ADHD, and that's not one of his specialties. There's not an enormous red flag here. I was just looking for medication management, which he should be able to provide. So let's go on to the actual report he wrote up about me. To read this report, we have to go to the UC San Diego Health patient portal and log in. Go to visits. Office visit on August 11, view notes. And these are the what's called the progress notes. There was no progress. I'm going to read through each paragraph of this rather quickly. This can probably be a little bit dry for a lot of people anyway, but I want to go through what he said here. sometimes what people leave out of a report is just as important as what they leave in. So I'm going to do another video on the office visit itself, what I remember from that meeting and what he said here. But one thing I do want to mention is this report had a tremendous number of spelling and grammatical errors, more than 20. And in any other profession or business or even school class, anything beyond freshman year in high school, nobody could turn in a report with that many spelling errors. I mean, the first thing I want to say is, use a damn spelling checker, dude. So let's just start reading this. Robert M. Gordon is a 69-year-old male with a history of ADHD diagnosis. That is correct. This 69-year-old male came in requesting to renew treatment for ADHD. Also correct, I don't particularly like being referred to as my age. My age is not my identity. Patient has many issues about his previous treatment and diagnosis with different psychiatrists that he wished to discuss. In particular, he was clearly quite upset about how he had been criminalized, in quotes, by some psychiatrist he encountered in the past. That is also correct. I don't like the way he put criminalized in quotation marks. That does indicate he doesn't believe it or he has doubts about it. We now know that the people who did it are actually colleagues of his. I did not know that when I started looking for help with this issue. Patient states that he never knew what was wrong with him through his life, but all his life he suffered symptoms that he attributes to ADHD. He said about 6 years ago, he started to seek mental health evaluations. About 4 years ago, he started working with a psychiatrist at Family Health Centers of San Diego by name of Dr. Urbe. He said after 3 visits, Dr. Urbe concluded that he had ADHD and embarked on a treatment plan that included an alternating schedule of Adderall and Ritalin. Patient relates that the treatment was life-changing, and for this reason, he said his level of functioning improved. This is also more or less correct. Unfortunately, about 3 years ago, Dr. Urbe abruptly left the practice, although the circumstances of his leaving were unclear. Subsequently, patient tried to see 2 different psychiatric providers associated with family healthcare centers, but conflicts arose because the psychiatrist became, I think he meant to say concerned. There's a lot of errors in this. I'll say concerned about the accuracy of his diagnosis and his cannabis use. Patient was told he needed to have a battery of psychological tests and urine screens done with zero tolerance for substance abuse. The word zero tolerance was never said in this meeting. It was never said by myself. It was never said in any of those previous meetings. I'm going to call this a lie. I think this is not just a mistake because I believe that's a buzzword that they use at UC Health. And he said it repeatedly. So I do think that rises to the level of a lie, not just a mistake. Patient reports only minimal cannabis use. Definitely true. Very minimal. Drugs. Patient apparently disagreed with the recommendations, and in subsequent interactions, one of the psychiatrists became concerned that the patient was actually in some way threatening towards them, and therefore they filed a restraining order against the patient. He feels very traumatized by the experience. This is only partly true, and there's some just really things that are misleading here. Saying I disagreed with the recommendation, again, these were 10-minute meetings. There really were no recommendations. The cannabis was an entrapment. That was done by a psychiatrist by name of Dr. Derica Aragon. Long after I had undergone withdrawal from the Adderall and Ritalin, and it was already low doses anyway. That was long gone. There were no recommendations. Well, there were, but they were kind of barked at me in the meeting, 10-minute meeting. You know, it's hard for me to consider these people actually providing any kind of care. It was done in retaliation for 2 things. For my threatening to report Joe Sepulveda, her boss, to the medical board, California Board of Medicine, whatever it's called, and more significantly that I banned him from seeing my psychiatric records. So this is really just, kind of sketchy. Psychiatrists became concerned patient was actually in some way threatening for them. I just have to say, threats were never issued, ever. No one could ever put quotes around a threat I made because there were none. The best the attorneys could do, and this was actually their opening argument, is that I am such a good writer that I cleverly hid my threats of violence into double entendres and innuendos. There were no threats. The only threats that were made were to report Joe Sepulveda to the medical board and banning both him and Dr. Aragon from my medical records. So let's move on. Subsequent to this, patient apparently engaged with different telehealth providers, and he said that he did have some success with them. That is not correct at all. I think he meant to say did not have success with them. The report is so sloppy and there's so many mistakes in it that it's hard to say for sure. So I'm not going to call this one as a lie, but actually I've had a disastrous experience with them. The first one was a psychiatric nurse practitioner. I got her about 4 months after Family Healthcare Centers in San Diego kicked me out of their program. And all we did was engage in bewildering arguments about cannabis. At that time, I had not seen my contaminated psychiatric records or just the bald-faced lies that are just spewed all over them by people, again, I've only met for 10 minutes. So I'm not going to call that a lie. I think it's a mistake. I did have another one that also did not go well more recently. And it again is because of, I won't tell that whole story here, but it is because of that, the same experience. So, you know, a serious mistake, not a lie, I don't think. It sounds as though patient has been off his stimulants for at least 1 year. However, when I reviewed cures, there's no controlled substance history that came up in his profile. This sentence just doesn't make sense. Cures is the system that the state of California uses to track substance use or drug medication use. And he should know that those records are wiped after a year, or you know, if you're regularly using it, and it has been a year now, just a little more than a year. There's more to the story than this, actually, also, because when I was in that first original meeting, the 10-minute online meeting with Dr. Sepulveda, he told me I was under investigation by law enforcement. I totally freaked out, and I said, who's under investigation? I needed to know the agency. I wanted to talk to them. I wanted to straighten it out. If I was under investigation, I wanted to face it straight on. Dr. Sepulveda backed out of that. I subsequently called spoke with their director of mental health, Myra Booby, and her last name has recently changed to Sepulveda. So her name is now Myra Sepulveda. I don't know if they're married or not. God help us all if they are. But she told me that it was Cures. I didn't really know that much about Cures at the time. She told me it was the Cures database he was talking about. Patient presented today with high anxiety, but also a considerable degree of distrust for the psychiatric community. He believes that there were not only issues in the way that the psychiatric profession cares for patients, but also the healthcare system is not operating in patients' best interest. Like, in spite of the bad English there, I guess the first thing is there some reason I should have trust? I would say profession. He says I don't have trust of the psychiatric community. Is there a community I've run afoul of? I probably should know that. I kind of like to use the word when people say business community and they pretend they're representative of the business community or small business community or whatever. There really is no such community. It's a lot of individuals. So, you know, if there's a psychiatric community, I guess I'm sorry I've run afoul of them. But the say that I think the healthcare system is not operating in the patient's best interest, is that really that radical of a thing to say or think? It seems like that's kind of a common thing for people to think these days. The anxiety, maybe. Um, Patient otherwise said he does not think he has any other mental health issues. I don't. I mean, not major ones, not ones. I have ADHD. I don't know why that's not accepted. I've been diagnosed repeatedly, a couple different psychiatrists who provided medication, and it seems like everybody is, bound and determined to, say I have something else. What happened at Family Healthcare Centers of San Diego was they did a mass diagnosis of like a bunch of people that had ADHD, and I was re-diagnosed as being a depressed substance user. I have half jokingly thought to myself, I wonder if I went in and say, "Oh, hi guys, I need some help. I'm a depressed substance user." It's no, you're not. You have ADHD. Do the Huckleberry whitewashing the fence mode or whatever. I'm not showing my age with that metaphor. Let's move on. Patient in the past has been told he needs to have neuropsychological testing done and drug screening done as part of his treatment plan, but highly resents having to do so either due to the cost or feeling tests are not necessary. The name neuropsychological testing was not used in the past. That is his word. Again, the people who recommended that they were 10 minutes, one of which was non-consensual. The words I use, you have to go through a whole battery of psychological tests. I know a guy who went through it. I'm going to make a separate video on that because that's a big issue in itself. There's no overt lies there, but that is misleading. Patient in the past, okay. I explained to patient today that is pathway forward. That's his words, SIC as they say. I explained to patient today that is pathway forward would be a collaborative partnership. However, he has very strong feelings that psychiatry is trying to force him to do things against his will that may hinder his approach. I reinstated him that his participation in our treatment plan is voluntary. However, safe and reasonable parameters still need to be followed. If you can tolerate the horrible English there, he still makes a number of misleading and I believe one lie in this paragraph. I explained it. This one, collaborative partnership, that was never said. Never. Those words were never said. What he did say was relationship, that we would have to have a relationship. And then he proceeded with explaining every reason I would never want to have a relationship with this man. My real psychiatrist never said I had a relationship. He was more like a grizzled old car mechanic who gets the car running again. Do you have a relationship with your car mechanic? Maybe, somewhat. But not that kind of a relationship. If he left town, he probably wouldn't call you. And neither did Dr. Herbe when he left. This paragraph is so bizarre. A considerable degree of distrust of the psychiatric community. He has very strong feelings that psychiatry is trying to force him to do things against his will. Psychiatry is a profession. I don't believe a profession is trying to make me do things against my will. So that, I didn't say that. I'm not going to call it a lie, but it's strange. That will hinder his approach. I don't know what that means. I reiterated him that the participation in our treatment plan is voluntary. However, safe and reasonable parameters still need to be followed. Despite some reassurance, patient still remains ambivalent about our programs here, but we ended our session with my recommendation that complete neuropsychological testing diagnosis and the return afterwards to review results. In the meantime, he will send records for my review, which I did. I sent him the full psychiatric report plus copies of the restraining order that were signed by Dr. Sepulveda and Dr. Aragon, where they pretended they were my psychiatrists who had been providing treatment for a long time when I suddenly and inexplicably went off and started making violent threats, which never happened. So let's keep going here with the rest of this report. Past psychiatric history, diagnosis. The references on his chart that he suffered from generalized anxiety disorder, ADHD, seems to have been seems to have principal diagnosis. I'm filling in his errors for him without even knowing it. But, there's so many sentences in here that are not grammatical. The general anxiety disorder probably is on my chart, but it was before the ADHD. My life was not perfect after the diagnosis and medications, but it got a lot better. Patient is going to forward to me from family health centers that I can review them. The language is so horrible. I did that already. Medication, substance history. Patient was very defensive about questions about substance abuse, but said that he has used cannabis only intermittently and not in an abusive. No period, just kind of dangling there. That's not exactly correct. I'm not going to say it's a lie, but it's not correct and it is misleading. I was not defensive about questions about cannabis use. I will address them, and I will take the urine test also if he takes them also. I was defensive about being required to have a urine test. I'm 69 years old. I don't think I should have to do that anymore. I thought I even had an agreement with UC Health, Department of Psychiatry, kind of an unstated agreement. I would sign the controlled substance agreement. I had no problem with the one I signed with Dr. Urbe. It was perfectly reasonable agreement. And the urine testings, I actually have my own policy. I did accept that they reserve the right to urine test. That's even understandable. If somebody really looks like they're seriously abusing drugs, maybe you should do that. But I thought I kind of had a wink and a nod agreement where people were kind of saying, and the administrative staff, they couldn't say anything overtly, but they were kind of saying, this is something you should not have to worry about a whole lot. Turns out I did have to worry a whole lot. This whole meeting was a colossal waste of my time. And it continues to be a waste of my time, and it's going to be more of a waste of time for staff members at UC Psychiatric Health, because I'm going to be doing a number of filings. I'll talk about that later. That will take some time, but there'll be a reason for them. So that is not correct. I wasn't defensive about questions about substance abuse. We can talk about them all day long if you want. I am very sensitive about being forced to urinate for another adult. The Constitution of the United States gives people the right against unreasonable searches and seizures. I can't imagine anything more unreasonable than ordering someone that you have the right to search their body fluids. A quaint notion from a bygone era, I know, but I do believe that. So we'll go into that in some detail later. Let's continue going through this report. Allergies, blah, blah, blah. Here's psychiatric specialty examination. I don't know what that means. Depression questionnaire, they're all extremely eager to diagnose you with depression. That's their all-purpose diagnosis. I didn't like the questions I answered. They seemed irrelevant to me, but I answered them all. So these are probably things I did say. I don't know what functional means. Extremely difficult, abnormal. I'm not sure what that means. It does not sound good. GAD-7, general anxiety disorder, mental examination. Patient appears to be somewhat disheveled today. Oh, God, what a jerk. I'd showered, I'd shaved, my clothes were freshly laundered, and I was using deodorant. I'm not sure what else. I had a clean t-shirt on, I wasn't dressed up, but I didn't look like some walking slob. If Dr. Bishop is nice and prim and dapper, I'm sorry I wasn't up to his standards, but that's just offensive. I'm not sure why it's in here. I'm not going to call it a lie. From his worldview, maybe I do look disheveled, but maybe I do to you too, but at the time, I don't think I was. Medical decision making, I don't know what this means. Robert and Gordon, 69-year-old male with history of ADHD and anxiety, who presents to clinic for a psychiatric intake appointment. Patient is seeking care for ADHD, the diagnosis that was given to him approximately 4 years ago by an outside provider, 4.5, more like it. Patient has a very challenging time since his previous provider left abruptly, and being able to reestablish psychiatric care as he desired it to be. Yeah, I don't like the way I worded that. Unfortunately, through that process, patient has felt victimized and traumatized by the healthcare system, and for that reason, he presents today with considerable trepidation and distrust about any treatment recommendations. again, is there reason I shouldn't be a little bit wary? I got in trouble because I wasn't wary. When Derica Aragon, just out of college psychiatrist at Family Healthcare Centers of San Diego, was in her interrogated me. That's what I call it. She got to the very last question of that interrogation, and she said, "Have you ever, during the past year, at any time, in any form or amount, used cannabis even once?" That's pretty close to the exact way she said it. And at the time, I was using it. I like it less when I'm on medications. I use it almost never when I'm on medications. At that time, I was using it probably once every 2 months when I saw an old college buddy. We got together, we would party, do shots of tequila, and maybe do some other substances. You always got to watch out for those substances. So forgive me for being born. It was very little. I said yes. Saying yes, being honest in that situation, was the worst mistake I have ever made in my life, bar none. So yes, trepidation, if that's your word, I do have some. Let's move on. It is difficult to say based on presentation the exact nature of his psychiatric disorders. However, his anxiety, suspiciousness, and circumstantial and tangential thinking patterns of thought are concerning. They're concerning. You forgot the period, by the way, but there's so many grammatical errors in this, who cares? Concerning rent, that's how Elon Musk, if you're following the meltdown on Twitter that he's having, he always says concerning to things he doesn't like, when he doesn't want to say right out loud. So, Dr. Bishop, a number of things you said in that meeting today were also concerning. Moving forward, plan is that neuropsychological testing should be completed, and if we elect to treat ADHD with stimulants, that drug monitoring, including drug testing with zero tolerance, would be required. Again, zero tolerance was never said. He mumbled. He did mumble a little bit about it. He said his exact words were something like, "We don't use cannabis here." It's unclear of who "we" is. I don't know if he's talking about the UC San Diego Health Department of Psychiatry, or "we" as the psychiatric profession, or "we" as, I don't know who "we" is, but that is the actual way he said it. Patient was given a list of providers psychological testing. He said that once schedule a follow-up appointment. If you can decipher that question or that statement, help me out. But he did send me a list of recommendations of this neuropsychological testing. It was just the sloppiest list of recommendations I've ever seen. He didn't even bother checking his own references. The very first one on his list, labeled number 1, wasn't even in business. Another one cost like $4,000, and they had a 2-month waiting list. That's used car prices. $4,000. They were just messy, all over the map. It was punitive. He did it for punitive reasons, and he didn't even bother checking his own references. Sloppy, disorganized work. Strength, seeking treatment voluntarily, history of independent functioning, accepts the need for medication, therapeutic intervention, intact cognition, has insight into illness, stable vocational history. I don't know if I've seen say that exactly. Got hundreds of jobs. Some unknown combination between my chosen profession as a contract project manager and my condition. I've worked hundreds of jobs in every industry, overseas gigs. I was even briefly a program manager in Silicon Valley at the end of the .com boom, with 25 project managers reporting directly to me. I did a 2-year gig in Africa for Royal Dutch Shell. I did time overseas in El Fayoum, Egypt for the Agency for International Development. I've done small business consulting contracts, temporary contracting gigs that would last maybe 6 months or that kind of thing. So stable, I don't know if I'd use that word. But this one bothered me. Adequate financial resources. If there's one thing he should not have gotten wrong, it's that. I mean, that means he doesn't know anything. That, as far as I'm concerned, even more than the numerous grammatical and spelling errors, that discredits this whole report. When I first contacted them, I have an online store, and it's not going too badly, but I was getting overdraft fees. I would make a sale, and then my overdraft fee would wipe out the profit and then some. You know, I was extremely distressed and distraught about that. So saying I have adequate financial resources, I don't know what the hell he's talking about. He just made it up. I should call that a lie. It's close to a lie. It's either a lie or incompetence or something. That should not happen. History of treatment adherence, that's true. I never misused those medications, not once. I never took too much. Uh, I never misused that, even a little. I'll take a lie detector test or polygraph. Stable living arrangements, sort of true. Average intelligence, I don't know if that's true or not. Comprehensive suicide risk assessment was performed, I don't know. Existing psychiatric diagnosis, male, gender, and older age. Older age comes up in this. I'll go over it in another video. I think there was over age discrimination in the actual session, which really this does not get very much insights into. I'll make another video for that, but I do believe there was over age discrimination. That patient also has protective factors of future life plans, kind of maybe, but he doesn't know what they are. Coping skills, do I? And access to healthcare, just barely. Nothing there probably rises to the level of lies. It's kind of weird, but diagnostic impression, focus and concentration deficit. Okay. Rule out ADHD inattentive type. I don't know what he means by that, if he's going to try to get rid of my ADHD diagnosis and say I'm a depressed substance user or whatever. I have considered recently that I might have the full ADHD, the hyperactive type. I'm the lower end of the hyperactivity. When I was a little kid, I wasn't bolting out of chairs all of a sudden, but I still have to. I can't, for example, talk on the phone without walking around. So, you know, I'll give him that. Whatever he's saying, it's unclear, but we'll just not say. Medications provide. Okay, this is bizarre. Provided psychoeducation, supportive therapy, and empathetic listening today. Wow. If that was the therapy, save me from it. That was the worst therapy I've ever had in my life. I walked out of that meeting feeling like shit. Empathetic listening. He sat there silent for the first maybe 15 minutes and let me talk. I didn't really like that. If you know anything about ADHD, we prefer to be interrupted. I didn't, even though I knew he had been thoroughly briefed, or I was pretty sure he had been thoroughly briefed by staff, I didn't know what he didn't know, what he had doubts about, anything I could clarify. Clearly, I should have done something diverse. Clearly, he should have asked something. But if he calls that therapy, that's got to be a low-level lie. And empathetic. I mean, if somebody thinks they're doing it as a lie, I guess I won't call it a lie. But that's pretty lame to say that he's discussed suicide and emergency room precautions. I think he went over that. Discussed risk benefits, alternatives to medication, patient voiced understanding. That's a lie. That never happened. That never happened. We didn't discuss alternatives to medication. So he does have 3 lies in this report. Cures reviewed reveals no suspicious activity. Disposition, patient will schedule an appointment once he has results available. My review, again, language is horrible. And that is it. It is signed Gregory Floyd Bishop, MD, staff psychiatrist, UCSD, OPS. So that concludes my review of my psychiatric evaluation that was done by Dr. Gregory Bishop at UC San Diego Health Department of Psychiatry. It's a sloppy and disorganized report, and it bears little, if any, resemblance to the actual meeting we had, or session, I believe you call them. Excuse me. I'll be doing 2 more videos. One to go over the actual session. In that one, it will be his word against mine. In this one, you can actually see the words he's written. Again, little resemblance. I'm almost convinced, I am convinced, that he decided before the meeting what he would do. The 2 issues I was most sensitive about, this neuropsychological testing and drug testing or urine testing, I expressed sensitivity before that to those issues, and that's why he decided to do it. Either punitive, or more likely just to get rid of me. You know, they have an unlimited supply of people asking for help, apparently. Anybody that causes the slightest amount of trouble, get rid of them. They don't count failures in their system either. I'm going to try to do a failure analysis of that group. I'm going to be issuing a Freedom of Information California Public Records Request Act to them. I'll hopefully have that done within a few days. The other thing, I believe there was a very major conflict of interest in this. At the time I requested help, I thought that Sepulveda was claiming to be an assistant professor at this organization. I didn't believe it. I had contacted the Department of Psychiatry a number of times about it. And I still don't think he is. But I have subsequently learned they are in some kind of negotiations with him. On the Department of Psychiatry website, they have actually listed him as one of the leaders of the psychiatric community in San Diego, or the mental health, something. I'll get a link up to that. That should have been disclosed. I'm now convinced that he did this. I was talking about a colleague of his, and that's why this was done for retaliation, or just to get rid of me. So the next two videos, I'll be doing two more. One to go over the session itself, and one to go over the recommendations. They were all bogus. The individual services weren't bogus, but the way he presented it, you know, here's a smorgasbord, you have to pick, you have to spend a lot of money, you have to spend a ton of your own time, then come back here, get also urine tested, and after a long time, we'll decide if maybe we'll allow you to be treated for ADHD again. It's designed to maximize public cost, maximize his own convenience, and I'll be going over that meeting in another video. Thanks for your attention. I appreciate your listening.